We are 12 partners from 12 different institutions, and each partner brings a particular expertise. We have 5 endemic countries, Ghana, Cote d'Ivoire, Democratic Republic of Congo, and Madagascar, with Malawi being the country that will lead the way for all the strategies. They all have vast experience working in schistosomiasis and some in female genital schistosomiasis. And we also partner with European partners from Switzerland, Germany, the United Kingdom and the Netherlands, again with vast experience and expertise on different areas of schistosomiasis. So it is the first time that all these partners come together to try to tackle FGS in many different ways.
With this, we are trying to do things differently, so we have a whole package on integration. And right from the beginning, we are working with the policymakers, the program managers, the district directors of health. This time we are bringing in family health, institutional care, and other divisions together to understand it in a holistic way, so that when the woman arrives at the clinic, everybody there knows that this woman has come with this. We need to ask question A, B, or C, and stuff like that. So this is one of the interesting and unique things about the WINGS.
Female genital schistosomiasis is a neglected disease. It gets confused with sexually transmitted infections, and it manifests as sexually transmitted infections, and that is one of the problems that we have in teasing out what is and what isn't FGS. So it gets transmitted by the water instead of sexually transmitted. And this is important to raise awareness and to treat the disease. It is urgent because many countries, it's about 45 million women living with this disease, are not correctly identified and treated.
I think one of the biggest reasons why it has been overlooked is that this condition straddles between 2 programs, if I should put it in that way. Female genital schisto is under the guise of, should I put it, neglected tropical diseases, all right, because it is schistosomiasis. But then it presents as a woman's condition. So if a woman with the signs of FGS arrives at a health facility, she's treated as a woman that needs gynecological attention. So she's sent off to the gynecologist. But the gynecologist is not trained to look at issues to do with schisto. So FGS kind of finds itself in between the cracks with nobody taking care of it. But I'm happy that within the last 10 years, a lot of attention has been brought to it. And with all the work that is going on, we are looking at an integration of services so that the woman is taken care of as a whole person, not as an NTD or as a genital issue.
WINGS-4-FGS is an exciting opportunity to tackle female genital schistosomiasis from different angles. The main objective of this large consortium of our work is to find drugs to treat FGS by repurposing anti-inflammation drugs that are used very frequently in different countries, meaning that the drugs that we're proposing are available in country. They're not new drugs, they're not fancy drugs. So if the results are how we expect them to be, the future could look like an easy way of tackling FGS in an efficient way. And then, of course, we would like to integrate the findings of this comprehensive study into the health system of endemic countries. And so I think we're going to see some real change at the end of these 4 years.
There's an African proverb that says that if the broom is tied together, it is difficult to break. But if you take a single strand out of it, it's easy to break. We need to continue to work together. We can no longer afford to work in our silos, because the woman we are dealing with or the girls we are dealing with are whole beings. It's one woman who is dealing with the social, the psychological, the clinical, and everything. So let's keep working together so that we can come up with a meaningful solution to this problem that has plagued women for a long time.